Welcome to Uncaged. Today we're speaking with Cheryl Haibach. Cheryl, it's great to have you on the show.
Oh, thanks, Pam. It's great to be here. Appreciate it.
We are talking to Cheryl about really all the work that she's doing as a pediatric therapy services practice lead at Kelly Education. She's a vice president of Kelly Education. So we talk to her more about the work that she's doing in the pediatric therapy space, helping communities serve the whole child. Cheryl, it's great to have you on the show. Before we go deeper into the world of Kelly, let's talk a little bit about you. Tell us a little bit about yourself and your career.
Sure. So I started my career as a physical therapist. So that was the foundation of my education, where I was working, and really found a strong passion for pediatric therapy care. So that was really what I was doing, what I was interested in. I did that for quite some time. I opened my own practice and really grew that to several locations, and then really found myself kind of in the private equity space and kind of growing my career on that trajectory. But it has all led to being back and focused on the pediatric therapy world. So I'm really excited that I get to keep doing that.
So Kelly Education, just so I'm clear, they announced that Pediatric Therapeutic Services would be rebranding to Kelly Pediatric Therapy. Tell me a little bit more about that rebrand, and what does it mean for you guys?
Right. Well, it's a really exciting time for us. First of all, from a pediatric therapy space, we have this opportunity to service a lot of children in a lot of locations, and aligning with the Kelly brand that is well known across the United States really gives us a solid foundation that develops some trust, I think, out in the communities. And so we also have different levels of services that we're providing. So we're providing the school-based therapy services. We have acquired outpatient therapy services. So putting that into one brand simplifies it for patients, families, school districts to know where they can get the service delivery that they need. So it's been a really exciting transition for us to have that type of recognition.
So, it's interesting. I see this almost across every area of care right now. There just are massive shortages. There's shortages of nurses, there's shortages of doctors, there's shortages of psychologists. I was reading this morning of totally unrelated. There's shortages of electricians, supposedly. We need more electricians. But in your case, with what you guys are working on, certainly the big one is that there's this fact of one school psychologist for something like every 15,000 students. When you look at those numbers, what does that mean to you? What's the challenge, and where's the glimmer of hope of that we can figure this one out?
Sure. Yeah, we're seeing those types of shortages in every discipline that we service, to what you said earlier, in healthcare, from nursing, physicians. We see it in psychologists, physical therapists, speech therapists, across the board. There's a shortage. That really is, what's difficult about that is that we're losing some access to care, right? These kids are not getting the services that they have a need for, and that actually there's a demand for, in the sense that schools are regulated to have to provide these services. So we're really missing lots of things. It's causing stress to lots of people, right? Parents, as school administrators, all of those. So definitely that shortage brings a lot of concern to people, that kids are not going to get the services that they need. I think where there's hope is that we know that shortage is existing. It's happening everywhere. And we're starting to get a little bit better buy-in to the need for these services. I think we saw a shift in going really into more of a remote working model just globally, right? That definitely it took its toll on therapy as a whole. But we're starting to see people move back into the face-to-face and work environment. And I think that's going to be a really positive move for healthcare providers overall. It's going to get us more people back into that workforce. So I do see some positivity there. I also think that we're showing the awareness. More people are solutioning about how do we get providers to get into schools and get the education they need to provide the services that that we deliver.
So, I mean, one of the things that I think is interesting when I think about therapy is that, we see examples of groups that kind of focus on one element or another. I know that you and the team are focused on like everything from early interventions, school-based therapies, outpatient clinic care, all under one roof. Why did Kelly Pediatric take that kind of approach to try to really offer that entire continuum?
Yeah, I think there's two specific reasons that there's value to doing that. The first is the continuum or the care for the child. Starting from that birth to three aspect of the child needs services. We might be in their homes, in their daycares, moving them into that transition into the school aged model, knowing that they have a solid provider that knows what that transition and that patient journey or student journey really looks like. So you have an expert that's going with you through that entire space. And it may not be the same therapist through that entire journey, but the company as a whole is very well versed in all of the compliance necessary in each of those different capacities, or what types of things are going to be happening in transitions for patients and families to deal with. So we have the skill set to support them there. And the second trajectory really is providers, right? We are a pediatric therapy group. That's a small group of providers that you need in all of the therapy spaces, right? If you think about all of the speech therapists or physical therapists in the world, there's only a small piece of them that are actually doing pediatric care. So to button them in just to one of those places, we really minimize or limit the group of providers that we have access to. And by giving them the opportunity to kind of transition into any of those pediatric environments, we give them better access to trying different things in the pediatric space, retaining them longer because they have different career opportunities under that umbrella, and they learn a complete different capacity. So they're really a better provider, and ultimately that leads to better outcomes for our kids. So those are the two main reasons we're kind of operating in that way.
Yeah, now, I mean, Cheryl, you've been working in this space for a long time. And I mean, the reality is that, as we all know, problems and challenges just continue, they evolve over time. And I know that you have worked with some of the larger associations like the American Physical Therapy Association and the Healthcare Compliance Association. But I mean, when you're trying to kind of like move the needle on some of these broader issues, how do you and the team kind of coordinate with some of those groups to affect kind of scale change?
Yeah, the professional organizations from a therapy perspective, we have things like the American Physical Therapy Association, the American Occupational Therapy Association. All of those associations really work to provide not only training for providers and access, but different types of information in regards to, what's trending in therapy care, what is the new research behind it. So it brings all those providers and those entities together to enhance their learning opportunities, which really does improve their actual care. But they're also advocacy people, right? They help support what's happening in all of the systems, from payment reimbursement to what rules and regulations do we need to follow. And that's how that ties into the compliance perspective. So making sure that providers are delivering services the right way, and that patients are ultimately getting access to services across any gamut and any space, and equally across all district states that we have.
One of the things, Cheryl, I mean, we talked about already the shortage, and the need to, deliver more and more services. And I think that obviously just points to the demand, as well as maybe the expanded awareness, really, of and acceptance in a way, which is great. In some ways, I think about like, back in the day when I was a kid, we wouldn't have had any of these things, right? So I mean, it's amazing the progress that we've made so far. But I mean, certainly also when you look at some of the surging needs, things like autism diagnoses are up. Projected, I think, to grow again by like 22% over the next decade. How are we going to be able to reshape our solutions to meet that demand?
Yeah. We're seeing such a higher demand for lots of great reasons, right? Healthcare is getting better. So children are born prematurely and surviving. So there is a developmental need that's happening, and we're seeing the value of care. So we know that those services, kind of to your point earlier, those weren't big things when we were younger, but the research is showing that children are having better access to education, are contributing better to society when they get these types of supports early on. But as we're looking at the shortage, I think this is a great opportunity for therapists to really utilize some of the new resources that are coming out. Technology, there's lots of
Yeah.
ways therapists can use technology so that they can improve the time they're spending in, or minimize the time they're spending in documentation and treatment planning so that they have more direct time with the child. So there's lots of, I think, ways that we can manage caseloads, we can manage documentation by utilizing some of those new changes and resources that maybe therapists wouldn't really think to use. So there's
Yeah.
lots of hope there and how we can get better access to care for sure.
Yeah, I like that. I mean, certainly I hope that things like some of the new breakthroughs we're seeing in machine learning might offer some help.
Sure.
I spoke at a healthcare conference earlier, I guess at the tail end of last year, and we were talking a lot about some of those things, and there's some promise there. So it's exciting to kind of see how that will move forward. But I mean,
Absolutely.
look, Cheryl, you are a leader truly in kind of bringing these kind of solutions forward and bringing kind of, I would say, the worlds of healthcare and education together. And I mean, just to kind of pull it back and think about kind of the types of people you need. I often think about doctors because doctors and clinicians and anyone who works in the profession has to be so personable. They have to be like on that grassroots level almost sometimes with the customers and the patients. But at the same time, we need them to be macro, right? We need to somehow like bring that together. And I'd just be, when you're building that team around you, leadership team, how are you able to kind of bring that kind of balance together?
Yeah, that's a great question. And I think first of all, when you're the care provider, you're right. You're on the ground. You're really focused on what's happening at the child or the patient level. And then you need to have, I have a legal team. I have a marketing team. I have people that have to focus on what things look like all around us. But ultimately, I kind of focus it on three things, right? Are we focusing on the child, and are we staying very centered in the services that we're delivering? And how do when I'm talking to my legal team and we're talking about concerns and things that come up, how do what we do allow us to provide the best service to that child? And then are we doing the right things for our providers? Are we keeping them safe? Are we making sure that they have all the things in place that their service delivery can really be focused on? And then are we doing the right things from a compliance business perspective? So we look at all of those three components with a focus on what our quality and our outcome of care is. And when you can find really great team members that you trust to bring the feedback and have the discussion, you absolutely are focused on the best outcomes possible. And like I said, I have a really great legal team that supports me that I can have really open conversations with. I have a really great clinical team that has the experience out there, right? They're researching,
Yeah.
they're seeing what's going on and asking questions. And so when you have the right people around you and you are all focused on the same thing, it's really easy to get that team moving together.
Cheryl, I mean, it's amazing to talk to you about this stuff. I'm so happy that you guys are building more services like this. I really can't help but reflect back to the time when I was a student coming up, and I just wish that like more of these types of solutions had been available. So I'm a big supporter of this type of work. But what's on the docket for the Kelly Pediatrics Therapy Team as we go into the second half of the year?
Yeah, we have the opportunity that there are a lot of school districts that need our support, right? So we have a lot of net new contracts that we're going, and the goal really is to continue to expand into new states and new locations and communities to be able to bring more of our supports to them. And then also from a big picture focus of how are we growing and mentoring our providers? So we're constantly looking at mentorship and building that quality learning for each of them. Because ultimately, as we talked earlier, the shortage is there. And so we
Yeah.
really want to bring them in. We want to train them and retain them, right? To be able to deliver the services we need. So we've got a lot of work in front of us
Yeah.
the back half of this year for sure.
Awesome. Well, Cheryl, if someone out there wanted to reach out and learn more about what you're working on, where's the best place to find you?
Best place to find me, well, come and follow me on LinkedIn for sure. So Cheryl Haibach out there. I'm always open to emails and connections. So, cheryl.haibach@kellyservices.com is easy. Go to our Kelly Pediatric Therapy website. So you'll find us there. So lots of opportunities to get engaged with us for sure.
Excellent. Well, Cheryl, it's been amazing talking with you today. We've been talking to Cheryl Haibach today. She is the Vice President of Kelly Education, and she is the practice lead of Pediatric Therapy Services there, and been talking to her about all of the work that they're pushing forward with, and really how they're really facing and developing powerful solutions for some of the challenges that we see ahead in some of these therapy challenges, therapy areas. Cheryl, thanks so much for being on the show today, and we look forward to having you back.
Thank you, Pan. I look forward to it as well.
Cheers.
Bye.